Morning, it's JP Mocheti Heath here from the Church of Sweden, and this morning I'm with Patricia Machawira from UNESCO. Church of Sweden has been working with UNESCO on comprehensive sex education being rolled out in 21 countries in Southern Africa, and we're just going to get a quick update from her as to where we are in that process.
Okay, morning, Reverend Heath. Thank you very much for that. And we really, UNESCO really appreciates the support and the partnership that we've had with the Church of Sweden ever since the ESA commitment was endorsed in 2013. So now where we are is in 2016, the Ministers of Education and Health again came together during the last AIDS conference and said, look, this issue is still important. We need to really continue rallying around the issue of increasing access to comprehensive sexuality education and services for young people. So they reaffirmed their commitment in a document called Let's Step Up and Deliver. So that's enough at the political level. In terms of, on the ground, what we've seen is an increase in the number of countries that are scaling up comprehensive sexuality education. So we've seen inclusion of CSE in the curriculum. We've seen attempts to start strengthening the linkages with services. Obviously, we still need to do much more around the quality of the curriculum, around the delivery of comprehensive sexuality education, and also on the services side to ensure that once young people have the knowledge and they go to access the services, they find the services available, they find the service providers friendly enough, and they find the services even open after the school hours or whatever time that young people want to access. In 2017, in the meeting of the Technical Coordinating Group, what the group agreed is let's get all countries to rally around one of the ESA commitment targets. So the target that was agreed on was reducing early and unintended pregnancy. So the thrust and the focus now is to really work with countries to advocate for the different sectors to play their role in reducing the rates of early and unintended pregnancy. The work that we did in the region, we looked at who is getting pregnant in the region, and it's the poor, rural, uneducated young girls who are most affected. So we are really looking at, when you talk to ministries of education, they tell you that we do have re-entry policies, but the reality is that once a girl falls pregnant, they are not going back to school. In fact, the research that we've done showed us that of all the girls who fall pregnant, less than 5% make it back to school. So despite the fact that there may be a policy, a re-entry policy, there are still barriers that are preventing girls to go to school. So one of the areas that we are working on and focusing on in the next 2 years is a huge campaign on reducing early and unintended pregnancy, and we would really welcome the Church of Sweden to work with us on that. Another issue besides, that leads to the failure for girls to re-enter is the stigma that is associated with falling pregnant. So the campaign really needs to look at all levels, starting with the community, starting advocacy with the mothers and the parents to ensure that once a girl falls pregnant, we provide the support to enable the girl to go back to school. So working, and that's where we see a role for the church in terms of destigmatizing the issues around pregnancy. Obviously, as UNESCO, we are conscious of the fact that when a girl falls pregnant, it's a systems failure that is signaling. So we really need to, in the first instance, work with ministries of education to ensure that we prevent the pregnancy from happening in the first place, because it's early and it's unintended. But what we're saying is that in the event that a girl does fall pregnant, we really should also respect their right to continue with their education and provide the support that enables them to go back to school. So we really welcome your contributions and your support to the campaign.
Bless you. Thanks.